Hantavirus. New virus found in China. Contents. What is hantavirus? Types and symptoms. Transmission. Prevention and medication. What is hantavirus? An ortho-hantavirus or hantavirus is a single-stranded, enveloped negative-sense RNA virus in the family Hantaviridae of the order Bunyaviral, as these viruses normally infect rodents, but do not cause disease in them. Humans may become infected with hantaviruses through contact with rodent urine, saliva, or feces. Some strains cause potentially fatal diseases in humans, such as hantavirus hemorrhagic fever with renal syndrome HFRS, or hantavirus pulmonary syndrome HPS, also known as hantavirus cardiopulmonary syndrome HCPS, while others have not been associated with known human disease. HCPS is a rare respiratory illness associated with the inhalation of aerosolized rodent excreta, urine and feces, contaminated by hantavirus particles. Human infections of hantaviruses have almost entirely been linked to human contact with rodent excrement. However, in 2005 and 2019, human-to-human transmission of the Andes virus was reported in South America. Hantavirus is named for the Hantan River area in South Korea, where an early outbreak was observed and was isolated in 1976 by Ho Wang Lee. Types of hantavirus. Hemorrhagic fever with renal syndrome. Hemorrhagic fever with renal syndrome HFRS is a group of clinically similar illnesses caused by species of hantaviruses from the family Hantaviridae. It is also known as Korean hemorrhagic fever, epidemic hemorrhagic fever, and nephropathy epidemica. The species that cause HFRS include Hantan Dobrova, Belgrade Sarmiosol, and Punola. It is found in Europe, Asia, and Africa. In hantavirus-induced hemorrhagic fever, incubation time is 2 to 4 weeks in humans before symptoms develop. Their severity depends on the viral load. Hantavirus pulmonary syndrome HPS is found in North, Central and South America. It is an often fatal pulmonary disease. In the United States, the causative agent is the cynomolvirus carried by deer mice. Prodromal symptoms include flu-like symptoms such as fever, cough, muscle pain, headache, and lethargy. It is characterized by a sudden onset of shortness of breath with rapidly evolving pulmonary edema that is often fatal despite intervention with mechanical ventilation and potent diuretics. The fatality rate is 36%. Hantavirus pulmonary syndrome was first recognized during the 1993 outbreak in the Four Corners region of the southwestern United States. It was identified by Dr. Bruce Tempest. It was originally called Four Corners disease, but the name was changed to cynomolvirus after complaints by Native Americans that the name Four Corners stigmatized the region. It has since been identified throughout the United States. Rodent control in and around the home remains the primary prevention strategy. Symptoms. Early symptoms: fatigue, fever and muscle aches, especially in the large muscle groups thighs, hips, back, and sometimes shoulders. These symptoms are universal. There may also be headaches, dizziness, chills, and abdominal problems, such as nausea, vomiting, diarrhea, and abdominal pain. About half of all HPS patients experience these symptoms. Late symptoms. 4 to 10 days after the initial phase of illness, the late symptoms of HPS appear. These include coughing and shortness of breath, with the sensation of, as one survivor put it, a tight band around my chest and a pillow over my face as the lungs fill with fluid. Transmission. The viruses that cause hantavirus hemorrhagic fever have not been shown to transfer from person to person, except for Andes virus. For other species of hantavirus, aerosolized rodent excreta or rodent bites are the only known routes of transmission to humans. Similar negative-stranded RNA viruses, such as Marburg and Ebola hemorrhagic fevers, can be transmitted by contact with infected blood and body fluids, and are known to spread to healthcare workers in African hospitals, but do not transfer readily in a modern hospital setting with the appropriate precautions. Transmission through fomites, inanimate objects exposed to infection, has not been demonstrated in hantavirus disease in either the hemorrhagic or pulmonary forms. Prevention. According to the CDC, the best prevention against contracting hantavirus is to eliminate or minimize contact with rodents in the home, workplace, or campsite, as the virus can be transmitted by rodent saliva, excretions, and bites. Control of rats and mice in areas frequented by humans is key for disease prevention. General prevention can be accomplished by disposing of rodent nests, sealing any cracks and holes in homes where mice or rats could get in, setting up traps, or laying down poisons, or using natural predators such as cats in the home. The duration that hantaviruses remain infectious in the environment varies based on factors such as the rodent's diet, temperature, humidity, and whether indoors or outdoors. The viruses have been demonstrated to remain active for 2 to 3 days at normal room temperature, while ultraviolet rays and direct sunlight kills them within a few hours. However, rodent droppings or urine of indeterminate age should always be treated as infectious. Vaccine. As of 2016, there is no FDA-approved, commercially available vaccine against hantavirus. A vaccine known as HANTAVAX has been under study since 1990. As of 2016, the development was in clinical phase 3 trial stage. This inactivated vaccine is thought not to be effective against European hantaviruses like the Pumolipov virus. A killed virus vaccine is not being pursued because of the dangers associated with mass production under high containment, as well as the unresolved questions about the efficiency of the vaccine. A number of labs have been working towards a vaccine that would deliver viral antigens by either DNA vectors or as recombinant proteins. As of 2016, these recombinant vaccines will not be available in the near future. No WHO-approved vaccine has gained widespread acceptance, but the Korean Army is one of the largest consumers of the hantavirus vaccine, second only to public health centers. Treatment. Ribavirin may be a drug for HPS and HFRS, but its effectiveness remains unknown. Still, spontaneous recovery is possible with supportive treatment. People with suspected hantavirus infection may be admitted to the hospital, given oxygen and mechanical ventilation support to help them breathe during the acute pulmonary stage with severe respiratory distress. Immunotherapy. Administration of human neutralizing antibodies during acute phases of hantavirus has only been studied in mice, hamsters, and rats. There are no reports of controlled clinical trials.